My name is Dr. Alix Charles. I am a board-certified dermatologist, which is a physician that treats disorders of the hair, skin, and nails. I am a physician with DuPage Medical Group, the Dermatology Institute at Hinsdale. I'm a general dermatologist, which means that I treat a wide range of different skin, hair, and nail disorders. A large portion of my practice is also devoted to surgical dermatology, which means that in our office, typically as an outpatient procedure, we remove moles, cysts, and different types of skin cancer and other lesions and things that people have that need to be treated surgically, that need to be removed. Lastly, I also am a cosmetic dermatologist or an aesthetic dermatologist, which means that I do a fair amount of procedures that are designed primarily to improve a person's appearance and improve their skin. We do different procedures involving injectable fillers, a lot of procedures involving lasers, chemical peels, and different treatments like that. Always had a strong interest in science and in problem solving, and essentially that's what being a physician is. You're almost being like Sherlock Holmes on a daily basis, taking little clues and pieces of a puzzle and trying to put it together in a meaningful way so you can come to a diagnosis and hopefully an effective treatment plan for your patients. Some of the personality traits that I would say I possess, or I've been told that I possess, that help me as a physician are my patience. Definitely my curiosity. I tell my patients when they come to see me a lot that I actually do enjoy when I have tough cases come or things that have stumped other physicians or that have been difficult for somebody else to diagnose or to figure out. I think dermatology is one of the most interesting medical specialties available. First of all, when you're in medical school, oftentimes you have to make a decision between if you want to go into a medical field or if you want to go into a surgical field. With dermatology, you have the opportunity to do both, to diagnose skin diseases and treat them in a medical fashion, and to also use your hands and perform skin surgery and do cosmetic procedures. So that was one of the things that really attracted me to dermatology. The two best things about my job, I think, are one, the variety of patient types that I see. I'll treat a housewife in 1 minute, and then I'll go into the next room and I'll have a 2-week-old baby, and in the next room I'll have an 85-year-old World War II veteran. And so I feel I get to meet a lot of different types of people from lots of different types of background, and that enriches me as an individual because I get to absorb some of that background and some life lessons from them. So I almost feel as if I'm helping my patients, certainly with their skin condition, but they're helping me to grow as an individual as well. The other thing that I really enjoy about my job is on any given day I never know what's going to be behind the door when I knock, before I go in to see a patient. And so that makes it so that my job's never boring. It's always exciting. I went to medical school at the Mayo Clinic, and Charles Mayo had a saying that the interest of the patient is the only interest to be considered. And so I do try to live by those words. I try to focus on the patient and think about what's best for them first. I think exceptional care begins with recognizing that we're all people and that the person in front of you is deserving of your respect and deserving of your time and attention so that you can help them to better live their lives. That individual in front of you may not be your wife or may not be your brother, but they're somebody's wife, they're somebody's brother, and somebody cares about them. And I think keeping that in mind and trying to make that connection with an individual can push you toward leading them down a better path and providing them with the best care possible.